Okay, stop needling me. I'll give it a try. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for almost 39 years. Well, one thing I've learned over the course of my life is that if you hear the same thing from more than one source in a short period of time, it probably means you ought to pay a little attention. And recently I was talking with a friend who's having some health issues, not MS, but other ones, back problems and such. And she decided to try acupuncture. And she says it's actually helping. I was happy to hear that. Well, then just this morning, I saw an article that talks about acupuncture in the context of MS. And you better believe it got my attention. So let's take a look at that. So the link to this article appeared in my inbox. It's from the Multiple Sclerosis Association of America, What's New in MS Research, September of 2023. And they have the list of the headlines over here in a nice little box, so it's easy for you to scan quickly and see what you might be interested in. And what do you know? There happens to be an article about acupuncture. And I thought, oh, well, that's interesting because I just was talking with a friend about acupuncture. So let's click down to that and see what the article has to say. Pinpointing a way to relieve fatigue in multiple sclerosis, study shows short-term benefits of acupuncture. Well, okay, right off the bat, I'm wondering, well, fatigue, that would be wonderful if it could do something for that. And then the short-term benefits, I'm not sure what that actually means. Does it mean that you need to repeat the acupuncture treatments on a regular basis so that you continue to get the benefit? Let's see if the article talks about that. So they say 4 weeks of acupuncture significantly relieved fatigue in an international study of 60 people with relapsing remitting MS. And I don't know whether that means it wouldn't work for progressive, but I can't understand why it wouldn't. I wonder if they just used relapsing remitting people in the study, but let's find out. I see that they have a link to the study there, number 14, that's the footnote. We'll look at that in a minute. But let's just continue with this article for now. All of the study participants reported fatigue, were not experiencing an MS exacerbation during the trial, and were given the medication amantadine. And I have taken amantadine, and it actually does help some with fatigue, but I find that it's not 100% effective 100% of the time. So guardedly, I'd say it's useful, but for me, it was no magic bullet. And then they say in the United States, amantadine is approved by the FDA to prevent and treat influenza, to treat Parkinson's disease and related conditions, and to treat movement problems that occur as side effects of certain medications. In other countries, it is also used to treat MS-related fatigue, and some clinicians in the U.S. prescribe it off-label for that purpose, as my doctor did. The study subjects were randomized into 2 groups of 30 people each. People in the first group received acupuncture treatment 2 to 3 times a week for a total of 10 sessions over 4 weeks. They also received 100 milligrams of amantadine daily, as well as whichever disease-modifying therapy or DMT they were taking, if any. People in the other group took daily amantadine plus any DMT that had been prescribed for them. The study's primary endpoint was change from baseline in the fatigue severity score, FSS. I had not heard of that score. Okay, I have no idea what mine even is because I don't know how you score it. I'll have to look into that. Well, I decided I'd better go ahead and look up what FSS really is all about, since if I wasn't aware what it was, maybe others wouldn't be either. And it turns out it stands for Fatigue Severity Scale or Fatigue Severity Score, depending. So I guess you use the scale to get your score. And once I looked at this, I realized Oh, I've taken this quiz before. I've filled this out many times, and most recently was when I was taking part in the clinical trial of that supplement and they were specifically looking at whether it would help with fatigue. So as you go through this, and you can see, I'm going to just go ahead and expand this a little bit so you can see. They asked during the past week, have you had motivation that was lower, exercise bringing about fatigue, you get fatigued easily, fatigue interferes with my physical functioning, fatigue causes frequent problems, fatigue prevents sustained physical functioning, fatigue interferes with carrying out certain duties and responsibilities, fatigue is among my 3 most disabling symptoms, and fatigue interferes with my work, family, or social life. And I'll link to the article below, but you can see down there that it comes from a paper by Krupp and co-authors back in 1989, published by the American Medical Association. So it's a pretty standard tool. Anyway, now we all know what FSS is and what it stands for. The secondary endpoint was change from baseline in the multiple sclerosis quality of life 54. And that's another test I'd like to know more about because I haven't ever seen it, I don't think. At least not by that name. And again, the multiple sclerosis quality of life scoring table, which I found online and posted for you here, is a tool that I think I've used at least in part over the years I've had MS. I can't be honestly sure of that, whether it was this exact tool, but as you look at these questions, you can clearly see they do look familiar. Does your health limit you in certain activities? And you get to say yes a lot, yes a little, or no, not at all. Everything from vigorous to moderate activities, lifting, carrying, climbing stairs, bending, kneeling, walking, bathing, dressing yourself, etc. And this goes on. I think there should be 54 of them, right? Because it said 54. So it takes you a while to do this, but there are 54 questions and they are targeted at those of us with MS. There is a basic test that contains only 36 questions, but it's not targeted specifically at MS. So as we go through here, we can see, yep. And I remember filling out some form of this at many times in my MS journey. I imagine you do as well. I have no idea, though, how I scored on them, because one of the things that happens is they never tell you. And if they tell you, you should be really happy because, yeah, so, yeah, remember the faces? Yes, this is very familiar as I scroll through this now. And if your doctor actually tells you what your score is, you're doing better than me, because I don't think I've ever been told what my score was. Both groups saw their fatigue reduced over the course of the 4-week study, but people in the acupuncture group had a greater reduction in fatigue from their counterparts in the control group. And the control group was just amantadine alone. They also had greater improvement in their quality of life, including both physical and mental status, than those in the control group. All of those differences were statistically significant. No adverse events were reported in either group. Now, I will say this was a good clinical trial in that it was randomized and it was controlled. We did have a control. The only thing I might say is that the sample size is not really huge. You've got 2 groups of 30 people, so that's a total of 60. And I would like to have had a larger population to validate those statistics, but at least they look promising. I'm glad that they did the study, and we'll see what might happen in the future with this. In keeping with the adage that everything old is new again, the ancient practice of acupuncture administered by properly trained and licensed personnel may offer new hope to the estimated 2/3 of people with MS who experience fatigue. That's what this article had to say, but remember that they had a footnote to the actual study. So let's go ahead and take a look. And here we've got it on PubMed through the National Library of Medicine. And the study was called Effectiveness of Acupuncture for Fatigue in Patients with Relapsing Remitting Multiple Sclerosis, a Randomized Controlled Trial. And it was published online February 1st in 2023, so not very long ago. Here are the affiliations of the authors who are listed there above, and I am not going to attempt to pronounce their names because I'm only going to butcher them. But they are out of the School of Acupuncture in Beijing and the Multiple Sclerosis Research Center in Tehran, and also in the School of Persian Medicine in Tehran, and the, oh my goodness, I'm going to butcher this, Dongjimin Hospital, Beijing University of Chinese Medicine in Beijing, China. So Iran and China collaborated on this study, and I always appreciate seeing that researchers from more than one institution or more than one country have participated, because somehow to me it just feels like the results have more validity. Maybe it's just me, but I don't know. That's kind of how I've looked at things. And let's scroll down to the abstract. For background, they say that fatigue is experienced by more than 65% of individuals with multiple sclerosis. And that, I think, is a conservative estimate, because I don't think I've ever met anyone with MS who has not had some level of fatigue. Some studies, they say, have supported the effectiveness of acupuncture in improving the symptoms of MS. So that's their hypothesis. The objective of the study, the present research, was intended to investigate the effectiveness of acupuncture plus amantadine compared with amantadine alone on fatigue in patients with relapsing remitting MS in the remission stage of the disease. So when there is no active relapse going on, when there are no active new symptoms, and I assume maybe with MRI results not having any new lesions, I suppose. I probably have to see the full paper to know that for sure. And then their methods, this is how they did the experiment. In this randomized controlled trial, 60 participants with relapsing remitting MS suffering from fatigue were recruited and randomized equally to acupuncture, 30 people, and control, 30 people. The acupuncture group received treatment 2 to 3 times per week for 10 sessions over 4 weeks. Both the acupuncture and control groups received amantadine 100 milligrams daily and routine treatment with immunomodulators. The primary outcome was the fatigue severity scale score, which was evaluated at baseline and after 2 and 4 weeks. The secondary outcome was the Multiple Sclerosis Quality of Life 54 questionnaire score, measured at baseline and at the end of the 4-week treatment period. Their results were as follows. The severity of fatigue was reduced in both groups. However, after 4 weeks of treatment, the reduction of fatigue in the acupuncture group was more significant than the control group. And they've got their confidence intervals and all those numbers that mean really pretty much nothing to me because I'm not a statistician. Quality of life, including mental and physical status, was significantly improved in the acupuncture group compared with the control group. No adverse events occurred in any of the participants. And I have heard that amantadine is a pretty safe medication, and acupuncture also is pretty safe. Their conclusions are: acupuncture combined with amantadine and routine care compared with amantadine and routine care alone appears to be an effective short-term treatment for reducing fatigue and enhancing quality of life, including physical function and mental status in patients with relapsing remitting MS. It looks very promising, right? And I don't know, like I said, it may work for people with progressive MS and it may not, but I'm willing to give it a try. Actually, I really don't run out looking for opportunities to be stuck with needles. But from what I hear, the folks that really know how to do this are so good at it that you don't really feel it, or at least it's not painful. So why not? This seems like a pretty low impact study as far as the time that you have to invest, the chance of undesirable side effects, etc., etc. And you would know pretty quickly if it was working, so why not? It seems like something I ought to look into. Well, okay, so what did I do? I followed up. There's an acupuncturist that practices not too far from me, so I have gone to their website and filled out their little form with a question, and I'm waiting to hear back. I left my phone number. Hopefully they'll call. I'm not averse to trying this, actually. I never really wanted to voluntarily have needles stuck in me, but something about having MS puts a lot of other stuff in perspective. So I'm going to see what happens. And if I end up going, I will certainly let you know how it all turns out. And hopefully it will be a good experience that, in conjunction with the amantadine, which I have taken from time to time, might help with my fatigue, because that, to me, would be a huge advance in the quality of my life. Well, that's all I have for you today. Until my next video, take really good care of yourself. We'll talk again soon.